125 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
Questions for the panel?
My name is Johan Garcia. I'm the business manager of 78. We are the ones who actually do the abatement nowadays. I'm here because honestly I want to ask for your help. This is what the asbestos workers are doing right now, using for abatement. This is what we get. The moment that we put it on, it breaks. We are at the latency period for my members, for my brothers, for my sisters. Every week, I'm having a phone call of one of my friends passing over, having cancer, and getting sick. I'm here because honestly, we are the generation that we're doing the abatement. And this is, excuse my French, this is the crap that we get. We're talking about, yes, we need to ban it. But we are the ones doing the abatement. We are the ones that are taking the minutes of our lives and putting it in every job site that we go. I need your help. Rules need to be changed. Inspectors, we need to be hard on them. I am sick and tired that a company gets a violation and they only have to pay about 1% of the entire violation. It means if a company gets $25,000 in violation, they get the lawyers, and I know we have some lawyers out here, they pay only $1,000 for a $25,000 violation. I started in this industry since I was 16, 17. I know I'm gonna die. I know I already have lining in my lungs, but we gotta do something. That's why I'm here, and I need your help.
Thank you.
So what I'd like you to do is, that was a great introduction to the problem that we know not only exists within your union, but throughout the entire United States. I understand, and we are very much there, and our bill actually deals with legacy. But I'd like to introduce you at lunch to John Newquest and Mark Caitlin and some folks on our prevention board, and we can hopefully work together and build a cohesive strategy for that. I understand, I've been competent. So we're limited, so let's save that for lunch.
Thank you. And don't forget about checking that email that I sent you about Delaware.
I've seen the video, talk to the journalist.
All right, thank you very much.
Yeah. The fact is we have no national inventory of where asbestos still is in place in the U.S. We have no national medical screening for people who are exposed to asbestos, even though they continue to be at risk for disease. And in fact, we can detect lung cancer early through low-dose CT, so we have an effective method for detecting the most common lethal asbestos-related disease, and yet we have no way and really to put that into effect because we have no national medical screening program. Other questions, comments?
We're seeing the headlines with Johnson & Johnson and the mega settlements of millions of dollars. Can you tell us what's happening with your organization and what, are you doing anything related to the asbestos and the talc and Johnson & Johnson?
So, and that's John Newquest, for anyone. He's on our prevention board and had worked for OSHA, I believe, for 30 years. So great person. Thank you, John. As far as talc, and I'm happy to let Richard and Stephen and Arthur chime in as well. ADAO's position is obviously contaminated talc is unacceptable. FDA's known this for 50 years. Our bill deals with the impurities of contaminants in consumer products. So we have a policy issue. But I'll be honest, that's not enough. We have to show pressure within the agencies, FDA, CPSC, EPA, it's a long list. So the strategy, and I will be honest, looking at 750 tons of asbestos that come in for the chlor-alkali industry, talc is of great concern, but we have to stop the imports and the use also. So the media loves the talc because it has a beginning, a middle, and the end. And legacy is a wild card that they don't understand, except for David and some other journalists. So we do have a talc strategy. We'd love to have you share it.
Arthur.
Yeah, I think we also need to be aware that it's not just Johnson & Johnson. There are other companies in this country that have been involved in litigation. The talc that we looked at in India was from a major multinational company. It was not Johnson & Johnson. They're having their other problems with too much formaldehyde in shampoo, for example. So we need to keep in mind that it is a somewhat ubiquitous problem, not just related to one company. And the other key point to be remembered is how you go investigate and look for the material. If you do simple kinds of testing, you can design tests to not find things. What one needs to be clear about is that you use proper testing methods that maximize your ability, not minimize your ability to find the asbestos that is in the talc. We like to think that the paper we put out did make use of those more stringent laboratory methods, but like with other things and other situations, you can always go by the results you want if you can find a way to do that, and there are ways to do that.
Linda?
Just for the heads up here, I've been subpoenaed about 5 times by the talc industry. They are hot looking for a way out. So know that the talc strategy has to also have a legal strategy. These folks are being, awards are being of millions of dollars, obviously are being approved by the juries. So it's going to be an ongoing issue as far as talc. And I know that there are people here today, so not everybody is our friend or believes us with chrysotile. So just beware when you do have conversations.
Well, we have time for one more question if there is one over here. I thought I saw a hand.
Hi, I'm Maggie. I'm a mesothelioma patient. I just had a question, and he kind of touched on it, but with the certain types of asbestos that's banned, like in the construction industry, what is the fine, or what is the recourse if they're still using it?
As you already heard from our union colleague, fines through OSHA went up a number of years ago, but I think you'll find if you look at the data, not just in the asbestos arena, but in many other arenas where OSHA puts fines out there, they're litigated over, they're adjudicated, and the amounts that are actually paid are a very small percentage of what the fine should be.
Right.
You could have a huge fine. Where things are much more rigorous but much less frequent is when the EPA goes after removers of asbestos that do it illegally. I've been involved in a number of those situations where criminal cases have been put forward, and the Department of Justice steps in, litigates, and some very significant jail time and monetary fines have been put in place. But those criminal actions versus the administrative actions of OSHA are much, much more limited.
Maggie, I want to touch on your question, 3 very quick points. In '89, when there was a ban that was overturned in '91, only 5 commercial products remained so-called banned or highly regulated. 2, the only way the industry really wants to stop using asbestos is when lawyers, and lawyers here, sue them. They don't stop, and that's a Clarence Burrell lesson we can all take to our own graves, knowing that it's through legal mechanisms that the industry will have to pay, which makes them stop. Lastly, if I have to pound my fist 10 times a day, I want you all to know that when the EPA promulgates that rule, the significant new use rule that you will be hearing about, it's called a SNUR. The EPA has a snag in their SNUR. It is not a ban. It is not a ban. It will only require 15 obsolete product producers to ask the EPA for permission to reproduce, which that will not happen. So when they talk about a SNUR, I want to be very clear. That is not something ADAO supports. That is cockamamie nonsense. Deal?
And with that cockamamie note, we will close this panel and thank the panelists very much for informative panels.